Okay, I think it's 9 o'clock. So we'll start. Good evening, everybody. Welcome to this subject seminar on sutures and knots. As surgeons, I think it is important to know how to do proper knotting, surgical knot, so that one, you make the patient safe in your operations, and second, you can sleep well at night, which is also very important. So you should know, I think from the beginning as junior residents, you should learn the technique of knotting properly, so that your knots are always the surgeon's knot, especially in the most important aspects where the knot is critical. Second thing is, it is also important for you to understand and know the suture material that you use. So you should know which suture material to use in what situation. And especially it is in the same situation, same tissue in different circumstances, you may have to use different sutures. So it is important for you to know the sutures that you use for closure, abdominal wall closure, for skin closure, for arteries, bowel anastomosis, all these things. So it is important so that when you ask for the suture, you understand why you are asking for that. For example, you have to know the half-life of the sutures and what are you actually using it for. When should you use absorbable, non-absorbable, or delayed absorbable sutures, all these things. So I think it is important for you to understand these things, and I think the class will be a good learning point for Vinod, and also hopefully revision for the rest of you. I think all residents should go through the surgical skills, basic surgical skills course, where you will understand the nuances of suturing and knotting, and usage of all these suture material and all that. I hope all the others have gone through that, and Vinod hopefully will go through it this year sometime. Okay, now what I have thought is, because though it is a very important topic, that Abdul has looked at the presentation of Vinod, and I think it is important to Abdul to take his next step in becoming consultant. So he should be able to moderate this. So I'll just be there in the background and let Abdul moderate the class. Okay, over to you, Abdul, and over to Vinod.
Yes, sir. Sure, sir.
Shall I start, sir?
Vinod, yes.
Good evening to everyone. And my name is P. Vinod Kumar, and I am DNB first year PG. And today's topic is about sutures and knots. Introduction. So, generally, suture is a material which is used for apposition of the tissues to improve the healing and history of sutures. East Africans use tendon strips and acacia thorns for wound closure, and South Americans use black ant heads for the closure of wounds, and it helped as skin clips. And Indian surgeons use horse hair, linen, and silk. And by the due to development of textile industry, silk and catgut had become more popular. Characters of a suture: physical structure, strength, tensile behavior, absorbability, and biological behavior. Physical structure: if a suture material is smooth, it can slide easily through this tissues easily, so that damage to the tissues will be less. And if it is smooth, and the knots will be so slippery, so that multiple knots has to be required to make the suture so strengthy. And if it is rough, it is difficult to pass the material suture through the tissues, and it may damage the tissue. But knots are very effective if the suture material is rough. Tensile strength. Tensile strength is the force required to break the suture into two parts apart. And strength of a suture depends on thickness and material which is made by it. Tensile behavior. Suture material may be elastic or plastic. If it is an elastic, it regains its normal length once the suture is removed. And plastic material sutures may lose its original length and may change its shape from one form to other form. If material is rigid, it makes kinks at knots. And some such suture materials has memory. It regains its shape when it is in a suture packing. Biological behavior. The biological behavior of suture material depends upon raw material by which it is made. Natural absorbable sutures undergo proteolysis, which process is unpredictable, and synthetic absorbable material undergo hydrolysis, which is more predictable. Classification of sutures. Based on origin, it is natural and synthetic. Based on behavior, it is absorbable and non-absorbable. Based on structure, monofilament and multifilament. Based on origin, they are natural and synthetic. Natural are CATGUT, CHROMIC CATGUT, silk and linen. And synthetic, polyglycine, which is commonly called as VICRYL, polyglycoprone, which is commonly called as MONOCRYL, POLYDIOXANONE, polypropylene, polyester, polybutester, and polytetrafluoroethylene, dacron, and polyglycolic acid. Based on structure, monofilament and multifilament. Monofilament are nylon, monocryl, PROLENE, and PDS. Multifilament, silk, linen, dexon, and VICRYL. Benefits and drawbacks if it is a monofilament and multifilament. Monofilament are easy to slide through skins and less chances of infections because of less surface tension over the material which pulls less water, and it is difficult to knot because it's slow slippery and easily damaged by gripping. Based on behavior, absorbable and non-absorbable. Absorbable are CATGUT, CHROMIC CATGUT, VICRYL, MONOCRYL, dexon, and PDS. Non-absorbable are dacron, PTFE, PROLENE, polyester, and polybutester. Silk. Silk is naturally obtained.
Vinod, just a second.
Yes.
What is the difference between elasticity and plasticity?
Sir?
What is the difference between elasticity and plasticity? Hari is asking. Do you know the answer?
Yes, sir. Plastic material are those which, on applying force, they may change the shape and they never come back to their original shape. And elastic material are those which can stretch, but when the force is removed, it can get back to its original shape.
Okay. Any other questions from any of the PGs?
You know,
Sir.
This is your first class, I know. Don't get nervous. All of people who are there are your friends. So, just relax and talk comfortably. Okay, you can tell that you are very nervous. Don't be nervous.
Yes, sir.
You are doing well. So just relax and speak, confidently.
Yes, sir.
What you understand by memory of the suture?
Memory, sir, when the suture material is in the packets, they will exhibit that particular shape even after removal from that packet, sir.
Okay. So, according to you, monofilament or multifilament, which will have the high degree of memory?
Monofilament have high degree of memory, sir.
Okay. Because it is stiff and it is difficult, no? So, the high degree of memory, what is the side effect? So, it will lead to that not loosening and untying. Like it has a ability to lose it more. Okay. So, that is a message you understand from that.
Okay.
Continue, Vinod.
Yes. Silk is naturally obtained from silkworms. It is a multifilament material, which is in black in color and mainly used for skin, like fixing the drains. And it has an increased chances of infection rate because of it is naturally obtained which undergo enzyme proteolysis, which is more it causes more damage to the tissues. So it has more infection rate as it is a naturally obtained material. And tensile strength lasts when it is wet about 20%, and it loses 80%, 80 to 100% of its tensile strength in 6 months. Linen. Linen is a multifilament material which is non-absorbable, remain encapsulated in tissues as it is a non-absorbable due to inflammatory reaction. Fibroblasts activate and these undergo encapsulated in the tissue itself. And nowadays these linen materials are not used most commonly. And tensile strength increases when wet and loses 50% by 6 months and remains 30% at 2 years. CATGUT. These are the first used sutures which are made by the textile industries, which is brown in color and naturally obtained from the intestinal submucosa of the sheep. Highest enzymatic reaction because these are highly prone for infections as they are undergo a proteolytic reaction. So these are stored in isopropyl alcohol because it is more prone for enzymatic reactions when it is in the normal air. And tensile strength lasts within 10 days and absorbed within 7 to 10 days by enzymatic reactions. Chromic catgut. Catgut coated with chromium, and it has less enzymatic reactions compared with a plain catgut, and its tensile strength increases from 10 to 28 days when compared with plain catgut, absorbed by enzymatic reactions within 90 days, used in mucocutaneous areas like circumcisions. Nylon, commonly called as ethylon, it is a monofilament and rarely used as multifilament. It is a polyamide polymer. Its tensile strength is decreases by 15 to 20% per year and absorbed 15 to 20% per year. Used in skin closures, hernia repairs, microsurgeries, and ophthalmic surgeries. As it is a monofilament, it has less tissue reactions and it can be used over skins easily. And it is a synthetic material. It has less infections compared with absorbable sutures. So these are used on the surface areas, surface of a skin. VICRYL. VICRYL is a multifilament.
It's VICRYL, man. VICRYL.
VICRYL. It is a multifilament synthetic material which is available in violet in color and made of polyglactin. Tensile strength is decreases by 60% at 2 weeks and 30% at 3 weeks, and absorbed by 90 days by hydrolysis. As it is a synthetic material, it has less enzymatic tissue reactions. And so it is also called as workhouse of general practitioner, as it can be used from deep to super surface if the surgeon willing for use it. POLYDIOXANONE.
Vinod, hold on. VICRYL is not a name of the suture. It is a brand name. You
Yes,
can't use brand names.
Yes. Oh. It is a polyglactin polymer. Hello.
Vinod,
Yes, sir.
it is not workhouse, man. It is workhorse. It's a workhorse of the not general practice for surgical practice, which means it is the most common, one of the most commonly used suture material. Not workhouse.
Yes.
Okay.
Okay, sir. Yes.
I told you that I told you in the first class itself when I this one looked at your presentation, you should avoid using the trade name. You should use the generic name. Though you put it in bracket, I
Yes,
think
sir.
you should put polyglactin as a suture material, and VICRYL, if you want, you can put it in brackets.
Okay, sir.
You understand?
Yes, sir. Yes, sir.
In the exams, you can't write even whether it is antibiotics, mesh, suture material, or any equipment that you're talking about. You should use the generic name, specific name for the instrument or suture material or mesh. And in the bracket, if you want, you can use the the trade name.
Okay, sir.
Because Niranjan's point is very important, because you guys should not get into a habit of using trade names, whether it is for antibiotics or for suture material or for equipment or whatever.
Okay, sir. Yes.
You can't say Romovac drain,
Okay.
because Romovac is a company. So you should use the proper, you should use suction drain. Romovac
Yes.
is one company that makes suction drains. You understand, no?
Yes, sir. Yes, sir.
Okay. Continue.
Yes. Okay. Polydioxanone. It is a polymer of polyester, which is blue in color, and it is monofilament material. And it is absorbed by hydrolysis as it is a synthetic material, and it has less tissue reactions as it is synthetic material, and used for mostly abdominal closures and gut anastomosis, as it has long life of absorption of around 180 days. And its tensile strength is 70% at 2 weeks, 50% at 4 weeks, and 14% at 8 weeks. Prolene. It is a polymer of polypropylene, which is blue in color, and it is a monofilament, and it is the one which has highest memory, and it is to be knotted around 6 to 7 times, and its tensile strength.
Vinod, again, Prolene is again a brand name.
Yes,
Polypropylene is the suture material name.
okay, sir. Okay.
Continue.
And it is a
Continue.
non-absorbable suture. Yes, sir. Which is a non-absorbable suture. So it is due to inflammatory reaction, which is chronic inflammatory reaction, it is encapsulated by fibroblasts and used for mostly vascular anastomosis, mesh fixations, and rectus muscle closures. MONOCRYL, which is polymer of polyglycoprone, which is transparent in color. It is also called as white VICRYL, and it is a monofilament used mainly in subcuticular suturings, and its tensile strength is around 21 to 28 days and absorbed in 90 to 120 days.
Same thing here also. Monocryl is again a brand name.
Yes.
I think that is what he has done. I've told him to change it. He has not done that. He has kept all the trade names.
Yes, sir.
Okay, continue.
Yes.
It is not. It can be used for gut anastomosis also, not just for
Yes,
subcuticular.
Okay. Polyglycolic acid, which is also called as Dexon, which is a multifilament. Its tensile strength is lost by 40% at first week and absorbed by within 60 to 90 days by hydrolysis, as it is a synthetic material, and even it has less inflammatory reactions as it is synthetic material. Shall I continue?
Any questions?
Sure.
Anyone? Any PGs have any questions regarding the suture materials, where they are used and how they are used?
Indraja,
Yes, sir.
what is the why he has everything every suture he has said tensile strength decreases by this much. What is the importance of that?
Sir, tensile strength means the force necessary to break the suture material, sir. Like,
Why is it important? The suture maintains the tensile strength, absorbability, all these things. How long does the wound take to heal? When will the wound get its 50% of its strength? When will it get 90% of its strength?
sir, at the end of the week, sir, it will get 50%, and at the end of 3 months, it will get 90% of the strength, sir.
So that is new, is it? Because you are a damn good healer if that is the case.
Sir.
Hari?
Sir, sir, it will take 50% in I think 2 weeks, sir, and it is never
2 weeks,
100%. Sir, hello, sir.
Will you get 50% of the strength in 2 weeks?
Yes,
Abdul or Janani, do you know?
Yes, sir. So 50% in around 6 months and 80 to 90% in 1 year, sir.
You are guessing.
You know, so 1 year, but never, it is never 100%, 80% in 1 year, sir.
Correct. That is correct. But 50% in 6 months is a bit too far-fetched. Abdul?
Sir, in 60 days, it is 50%.
Correct. 2 to 3
And-
months, it will come, you will get into 50% range and 80 to 90% at 1 year. So why is this important, Janani? To know which suture to use where.
Sir, sorry, sir. Sir,
Why is
I
it
couldn't-
important to know the tensile strength, absorbability, wound, when does the wound, how is the wound healing progressing, and which sutures to use in what circumstance? Why is that important?
Sir, the first thing is to plan if at all it is a non-absorbable suture we use over the skin. When to remove the suture, we should plan accordingly, according to the tensile strength. And also when we use the absorbable sutures in intra-abdominal surgeries, we'll plan the suture material according to the tensile strength, sir. For different tissues, the different suture material tensile strength varies. That
So
is,
for example, Hari, what is the
Janani,
ideal?
I think you're wrong. You said what? Different tensile strength varies according to the different type of tissue.
type of suture materials we use, sir.
Okay.
So where to use which suture material, we'll plan accordingly, according to the
No, you
tensile.
said some sentence, no, in the last.
I said the difference is in different suture materials according to the tensile strength.
Hari,
Okay.
Yes, sir.
what is the ideal suture material for abdominal wall closure?
Sorry, the slow absorbable, sir. I mean, like,
Delayed
PDS.
absorbable, it's called.
delayed absorb. Sorry, delayed absorb.
So what is the material?
This one, sir. Polydioxanone.
Polydioxanone, or what is called as PDS, which is number one PDS. That is also, you should mention that.
Yes, sir.
And if at all there is potential for the wound to get infected,
Yes, sir.
then will you use the PDS or will you use PROLENE?
Sir,
Or even polypropylene, or even this one, what is the
Amide, sir.
one? What is that called?
Polyamide ethylene.
Not polyamide, this one, man, the ethylene.
sir, PDS is polydioxanone is a monofilament, sir. So that we can, for monofilament will be infection chances will be less, sir. So we can use in those case of infected suspected infection, sir.
I think whatever the situation, slowly I think Niranjan also, he can comment on this. Slowly the recommendation is that you use delayed absorbable sutures for closure, abdominal wall closure. I don't think there are any particular circumstances where you should use either nylon or polypropylene instead of PDS. Niranjan?
So that is what the current recommendation is, more for delayed absorbable. But depending on your preference, you can use nylon or also polypropylene. But
Polypropylene.
more so, the many of the surgeons and also the literature says delayed absorbable is fine, which is polydioxanone.
Correct. PDS, polydioxanone.
But never the VICRYL suture, that is polydiclopropylene.
So the closure of abdomen has come. The gynecologists used to use CATGUT, and then they moved to VICRYL, which is polylactin.
Sir,
all
will he
these
be
things-
talking about those the duration and all that later, or has he finished? I joined in few minutes late. That's why I don't know.
I think he's not talking about wound healing. He's only
Alla, wound
talking
healing
about.
alla, when will the suture materials get absorbed? What is the average?
ಅದೆಲ್ಲ
thing?
ಆಯ್ತು. I think each suture material as he went on, he
Okay.
spoke about the thing.
Okay, because one or two it was there and the others it was not there. That's why I thought he might be talking it little later because he might not have understood it completely.
Uh,
Okay.
Continue. Continue, Vinod.
Vinod, why was sir telling don't use VICRYL
It's
for
a brand.
abdominal closure?
Sir, VICRYL has it is only it is only its observability is up to 60 to 90 days only, sir. And it has less tensile strength compared to PDS. So PDS has around 180 days, and it needs more duration for its closure, sir. So we prefer PDS over VICRYL.
How much days? More days means how many days?
PDS has 180 days, sir, and
No.
VICRYL.
How long do you take the wound? If you say 60 days, 60 to 90 days, as Ravishankar sir told few minutes back, how much percentage of the wound would have healed? That this one would have healed in that many months.
In 3 months, it has gained only 50% of its strength, sir.
Yes, correct. Okay. Yeah, continue.
Yes,
The other thing is, Vinod,
sir.
see the polyglactin or VICRYL
Yes, sir.
is a multi-filament braided material.
Yes, sir.
One, it causes tissue trauma. So,
Yes.
and also it is more prone to getting infections.
Infections.
So, we should not use VICRYL or polyglactin for closure of the abdomen.
Yes.
Okay, right.
Needles. Needles in the past has an eye through which the suture material has to be loaded into them. But now it has a swag through which suture material comes with attachment, so that the tissue damage during suturing will be less. And parts of a needle is shank, body, and point. And needles should be grasped by needle holder at one third from one third from the back of the needle. The closer of needle holder is to be the closer the needle holder. The closer the needle holder to the tip of the needle, it will be the more accurate. That suturing will be more accurate. And types of needles are round body, cutting body, and reverse cutting bodies. Round bodies are used when in soft tissues like gut, and it is less traumatic. So it is used in gut-like structures, and cannot be used in hard tissues as it will slip over. Cutting bodies. These are used in tough and dense tissues like fascia and skin. These needles cannot be used in soft tissues like bowel. And reverse cutting, it has advantages of both reverse cutting and soft body. It is less traumatic and easy to penetrate, used in vascular anastomosis. Length of a needle. Most commonly used are half circle, and 1/4 are used in ophthalmologies, and J-shaped are used in vaginal and vaginal surgeries and pore closures. Thickness of a needle. So it is classified based on diameter in tenths of a millimeter. As the number increases, the thickness decreases, and size is directly proportional to its tensile strength. And more the number, then thickness of the suture will decrease. Shall I continue?
Just a second, Vinod.
Abdul,
Uh,
Sir?
Vinod, go back to your needle slide.
Yes.
No, the circle, the circle slide. Next. This we use port vehicle, no? Vinod, what is that? What size? Which part of? How big is the needle? Is it J-shaped or how is it?
It is J-shaped.
It's J-shaped, huh? Sure.
Yes, sir.
Rather than that, ask Abdul, what are all those needles and where do you use them? Those kinds of needles. 1/4 circle where, 3/8 circle where.
Hari,
Sir,
where all do you use these needles? Well, some of it he has told, but the rest, 1/4 circle, where do you use it?
sir, 1/4 circle needle superficial, sir.
What is not?
Like what is it? Like ophthalmology surgeries, like that, sir.
Generally,
Because it will be deeper means it will be difficult to take. So ophthalmology surgeries they use a lesser curvature needle, sir.
okay. So the port vehicle which we use, what is that?
I think it is 5/8, sir, because it is more because deeper they have to take the fascia.
Okay, fine. It's not the J shape. I think it's 5/8 only.
Yes, sir.
Straight. Where do you use it?
Straight for thick tissue closure, sir. I mean, like abdomen.
Okay.
Not sure, sir.
Janani?
Straight. I'm not sure, sir. Straight needle.
Thick tissue is fine, but where?
Mhm. Like in sole, no, sir. No idea, sir. I'm not sure about it.
Usually it is used for that
Adana.
nerve or vessel repairs, which are easily accessible. Okay, Vinod, next slide.
Sir, one question for Vinod, sir.
Okay.
Sir, whether you understood what is the difference between cutting and reverse cutting?
Yes, sir.
What is it?
In cutting the base of the triangle will be outer side, sir. In reverse cutting, the base of the triangle is inner side of the needle, sir.
In reverse cutting, it will be inside or outside?
In reverse cutting, it is inside, sir.
What makes it difference? Does it make any difference? Is it inside or outside?
Yes, sir.
Why is that? For example, if you are suturing a skin, will you prefer cutting or reverse cutting?
We can prefer both, sir. But I will prefer reverse cutting as it is because it can be used as it is even beneficial for soft tissues also.
Okay. But the ideal thing is it will be outside. The sharp point in the reverse cutting will be outside. Okay, so that the trauma, the skin cut through will be less in reverse cutting. Okay, so if you look at the body, the triangle sharp point will be pointing away from the surface. So that if you take a skin suture, the cut through will be less in reverse cutting. If you see the cross section image, if you have now, you will understand better. Okay, that is the one difference when compared to reverse and cutting and reverse cutting. Okay, go ahead.
Continue, sir.
Yeah, continue.
Suture knots. Granny knot and square knot. Granny knot is also called as slip knot. It is not a secure knot, and it is secured by using first throw right over the left and second throw right over the left. And square knot, it is also called as reef knot. It is a secure knot in which in the first throw is right over the left and second throw is left over the right. And these are the images of granny knot and square knot, in which and the same the suture material is which is blue in color are passing in the same on the lower side in square knot. In granny knot, it is one in the above and one in the lower side. And surgeon knot, it is for an additional security in which two throw technique of knot is done, and it is to prevent slipperage. And ABERDEEN knots, it is also called as loop in loop knot, in which free end is partially pulled through the final loop before cutting. This knot is used in continuous sutures. Sir, continue, sir.
Yeah, continue. Any,
Yeah.
you could have other photos are not there. Our ABERDEEN, not any videos are there.
No, I didn't add videos.
Okay, continue.
Nice. Since skin suture techniques, continuous and interrupted. Continuous are simple continuous and subcuticular, and interrupted is horizontal mattress, vertical mattress, simple interrupted, and subcutaneous. In simple continuous, it is used in when in uncomplicated wounds where less tension is there, and it is used. It is a faster application for you, and it is used in deeper tissues because when it is when the interrupted sutures are used in deeper tissues, it leads to multiple. We require multiple nerves, which lead to inflammatory reactions more, and it leads to infection. Chances of infection are more. So we use simple continuous in the deeper tissues. But the complication is when there is less knots. If if it is cut in between, it leads to complete loss of suture from the and subcutaneous sutures. Use it to close deep wounds in layers. Knots will be buried and inverted so that knots are not living in between the skin margins, so that inflammation and infection will be less. Subcutaneous continuous sutures. These are lateral stitches are taken beneath the epithelial layers of the skin. It is best for cosmetic results and used for patients prone for keloid formations. And simple interrupted sutures, most commonly used, inserted singly through side of a wound and tied with a surgeon's knot, and strong and can be used in the areas of stress. And in this, the knots are multiple, but when there is a if you need, when there is an infection and if you want to drain the pus which is collected inside the site, we can remove whatever we require. That particular knot can be removed and we can drain the pus. And vertical mattress, it is used for the deeper structures when there is a chances of wound healing are very poor. In this, there will be deep and superficial knots. The deep wound helps in approximation of deeper tissues closely, and when superficial sutures are helpful in getting good eversion of skin and provides maximum tissue approximation. Horizontal mattress. It is helpful in getting more amount of skin approximation, but the only drawback is it leads to decreased blood supply to the skin margins. Suture removal.
Wait, man. Go back. So, has everybody understood what he's saying? What is the difference between vertical mattress and horizontal mattress? Go to the next picture.
This one, sir.
No, the next picture.
Yes.
Can everybody see the difference between vertical mattress and horizontal mattress?
Yes, sir.
Okay, right. Continue.
Suture removal. In the scalp, sutures are removed around 6 to 8 days. On the face, lips, and lids, it is around 3 to 5 days. In the laparotomy or thoracotomy or earlobe repairs, it is around 8 to 10 days. And if it is in the palm, soles, and back, it is around 10 to 14 days.
Why this, Vinod? Why is variation in days?
Sir, over scalp and face, it will be more blood supply, which helps in early closure of wounds, sir.
Okay. Okay, fine.
Yes. And X2X rule, in which the depth of a wound is, if it is X, that the suture prick has to be X centimeters from the incision, and the distance between the two sutures should be 2x of the depth of the incision, sir. And Jenkins rules, and it is a when suture material has to be 4 times the length of a incision, sir. And
Is it end?
yes,
Vinod,
sir.
hello.
Yes, sir.
You should have put some recent papers, no, on various sutures, where they are used. Not only textbooks, you should have also used some papers to
Okay, okay.
present next time.
Yes.
This is first class. I think you should have.
Yes.
See, Vinod, you should ask your seniors, because before, Srikanth keeps saying this all the time.
Yes.
When you finish your presentation, you should first go to your immediate senior to show it to them and
Yes,
to
sir.
the registrar, and then come to the consultant once you've, done all the corrections and whatever suggestions they have given you, so that it
Okay.
is one learning process for you and learning process for them also, because they are also now starting to supervise you. So that is how everybody learns. And it will also lessen the burden on the consultant, because we can't keep on spoon feeding and hand holding you for all the things. You have to
Yes.
learn to start to become independent. You should learn from your seniors. Okay,
Okay.
so should show it to them, so they would have probably told you what to do.
Okay.
I thought because there were already 65 slides, I thought maybe you will overshoot, and that is why I didn't suggest any papers. But Abdul, frankly, what is new in the for example, in whatever he has talked about? Is there anything new that you can maybe look at the
No, sir,
papers?
regarding the research side, no, the delayed absorbable, some papers regarding that we could have added.
Kavya?
And which is the strongest suture in?
Sir, even
What
the
do you-
newer sutures also, caprosine, polybutester. Maybe he should have mentioned them.
Mentioned. He has mentioned it, but he has
I have
not
told him.
gone into detail about them. Yeah.
Even
He didn't-
polyglytone, all that for hypospadias and all that new materials have come now, sir. So
Yeah.
maybe.
They should have talked about it. Yes.
Yes.
See I think well, one thing, the good take-home message would be what is the ideal suturing technique for abdominal wall? What is the ideal suturing technique for anastomosis? All these things. See, there is no randomized control trial to see what is the best suturing technique for abdominal wall, nor there is any. So it's one for the anastomosis. I think it mainly boils down to surgeon preference and what you have learned from your seniors when you are learning, and what you see as is working on a regular basis. So I don't think anyone can criticize anybody for doing a 2-layered anastomosis as opposed to 1-layered anastomosis. I think both are equally good as long as you do it properly. You have to understand why you are doing 2-layer and why you are doing 1-layer. The most important thing is that the mucosa is the layer which you need to be worried about when you are doing the intestinal anastomosis, and the sutures have to be placed very carefully, diligently. Every suture has to be, every suture has to be visualized, especially in the corners, because they are called the corners of sorrow, because the leak happens most of the time at the corners. So you have to be especially on the mesenteric side. So you have to learn to make sure that your technique is good, so that you still, with the best anastomosis, still anastomosis can leak, but it should not be due to technical reasons. So that is what you have to learn. And even when it comes to abdominal closure, I think when you are doing it for virgin abdomen, for a standard laparotomy, for elective procedures, using a PDS continuous as a Jenkins rule, 1 centimeter across, 1 centimeter apart, which means the suture should be 1 centimeter across and 1 centimeter apart. So that gives you the best result. And the suture length has to be about 3.5 to 4.5 times the size of the wound, the length of the wound. So that is usually recommended when you are doing closure for a very bad peritonitis or dehiscence. If there is a complete dehiscence or burst abdomen, then you are well advised to put interrupted sutures. And many times in this, we use what is called as a near far technique, where because if there is a lot of sepsis, or if the abdomen has burst through, the strength of the rectus sheath and the muzzle may be, questionable. In that situation, taking a near far suture and interrupted sutures will at least hold the abdomen together. Many times, again, over a period of time, because of the infection and all the lack of nutrition and all these things, you may develop incisional hernia, but at least the abdomen is closed, and then you can live to fight another day. So you have to understand what sutures and how to use the suture material in each circumstance. Whenever you are doing vascular anastomosis, you always use PROLENE because that is the best suture material. Then for other things, you have to tailor make or customize the suture material for what you are using. Abdul, what is your final comment?
Sir, well presented. Little nervous in between. The slides could have been much better. The spacing, the wordings, pronunciation also could have been better.
Correct. Hari?
Sir, for first time presentation, it is good, sir. But they're nervous. Everybody, we were nervous. But few corrections I can tell him that 64 slides he presented in 45 minutes. So he was staggered and it is very fast. So he can little bit slow. And main aim of presentation is people should understand what you present. Even if it is less, also you should understand. So make it others to understand. And one more thing, you can see the videos from YouTube and sir's videos and everything. What I present, that will really help, which helped us. So start seeing videos and practice before presenting. In initial times, 2 to 3 times, you can practice. It will be better for you. That's all I wanted to say.
Kavya? Kavya?
Sir, well presented for the first time, sir. But yeah, as you're telling more about the midline closure and all, we could have specified like the stitch trial and the inline trial and all that, which were RCTs.
Correct.
So as you were saying, the Hughes method also now is under study. So the near far technique. So
correct.
we may have mentioned, but good for first time overall. Good presentation.
Okay. See, Vinod, the usual guideline is, you should have 1 slide per minute. So for a 40-minute to 45-minute presentation, you should have about 40 to 45 slides. Sometimes, if the material, material that you are presenting is quite intense, for example, fluid electrolyte balance or acid base balance or nutrition, or where it involves lot of understanding, I think then it may even go to 2 minutes per slide. Okay, so if you have a 1 hour presentation, you should have about 30 slides because you need a lot of elaboration of what you're talking about. So talk deliberately, talk slowly, talk clearly, so that you're not running through the slides. You want to people have to enjoy your talk and they have to understand it. It will come with time, but I think for a first presentation you did well. You were nervous, but I think you will get over it. As I told you, you cannot come to this class and present it first time. You have to present 3 or 4 times in your own room. Make sure you know exactly what you're talking about, and then come and present and show it to your immediate seniors and the registrars. Then get vetted by them, add whatever they suggest. I think you should add, once you become postgraduates, you are not just consulting textbooks. You should start consulting papers, journals, and things like that. So that is how you should improve. Okay, but good attempt. Okay, I think if there are no other comments, Niranjan.
So that is what it was for the first time. It was okay, but it was not an ideal presentation for sutures and suture materials. Lot of the things which he has missed it.
Yeah.
So it is a vital topic. Maybe he needs to present it in a much more better way again sometime later.
Yeah.
And he should take help of seniors. I don't think he has shown it to anyone.
No, he has shown it to Abdul and Kavya, but he has not made the changes that they have suggested.
Okay.
Because
it looked like a copy-paste job from Bailey and Law, basic stuff only.
Correct. Whatever they suggested, he has not changed it.
Okay.
So that is the problem.
Yeah. Okay.
Thank you, everybody. Good night.
Thank you, sir.
Thank you.